So we're going to do a little bit of neck work seated to start off, not a ton, just a little bit. I tend to do this rarely, but there are times it's helpful to be comfortable working on somebody in a seated position. If you have patients who are wheelchair bound or suffer from vertigo and can't lay flat. I've even had a couple patients who just have extreme acid reflux and they just can't be horizontal on a table. So if they're having neck problems and they want you to help them, one option is to be seated. A lot of this can be adapted to using a massage chair where they're forward leaning and you just bring the head upright as you work. Working as we do down into the traps and stuff, all that, you don't even have to move their position. You can do it in a massage chair as well. But if you're going to work on somebody in a seated position, the most important thing is to stabilize their head, because it's hard enough for them to try to relax their neck muscles in this position. If you're torquing on them and pulling and moving and their head has no stabilization, then it's going to be even tougher. So if you're going to work in a seated position like this, or with your patient in a seated position, don't be afraid to just palm their head like a basketball. Grab a hold of it and keep it as still as possible while you're working. Typically in this kind of position, we'll start with some gentle grasping just to loosen everything up. So I'm just using simple grasping motions with my right hand. So I've stabilized her head. And I'm getting those paraspinals and splenius capitis and cervicus and all of that fun stuff. You can kind of move up and down the entire cervical region with this. She has a collar I've flipped up as a friction break. If I do chair events, I bring pillowcases and I'll lay a pillowcase across their neck because the two layers of fabric sliding across each other gives me a wonderful friction break in this area without having to try to lotion them up if you're just doing a chair event. And it helps make it an easier transition across whatever kind of collar their shirt has. So that's a little random trick for chair work. Once I've done a little bit of grasping in this area to loosen it up, I'm going to do a little bit of tractioning with this hand. So I'm using that U shape that my fingers and thumb makes, and I'm going to be tipping her head back gently into that U. So I'm holding the frontal bone and I'm holding under the occiput, and I'm going to use my legs, not my arms, to gently lift up on her head. One thing about neck tractioning is you never release the traction in a different position than you started it in. So if I have her head gently tipped back and facing straight forward and I lift, I wouldn't want to move her head into another position and then let off that traction. You run the risk of having something not land where it's supposed to in the vertebral column. So what I like to do is tip her head back and get that traction, and then I roll her head through a little U shape, just rolling it around my thumb and index finger, holding that traction that whole time. And when I feel like I'm tired or I'm ready to stop tractioning, I come back to that same position before I release that. Simple and easy. You can make nice with a little more grasping. The other technique I commonly do in this area is a rolling variant. It's kind of like a reverse Shanghai roll. I call it forearm rolling, where I start with the hand pronated and I'm rolling my forearm into supination to work all along the upper trap and levator scap area. So I'm using my forearm, the blade of my ulna, and the meat of the flexor compartment both, just to come in and work. Again, trying to stabilize the head as much as possible. Be cognizant that you're not running across their mandible and that you're not pointed too far down and running into breast tissue. Try to kind of match the angle of the mandible. That'll keep you in generally a safe territory. Once I've done a little bit of that, I'm going to repeat that same idea of tractioning. So I'm going to gently lay her head over onto my forearm. So I'm up under the occipital ridge and the mastoid. And I'm just going to gently lift. And here we have a very limited range of motion we can move through, but we'll move a little bit around. Just check in if it's too much pressure on their ear or under the occiput or anything. Then we'll switch it up. Come and work on this side. This is the side that's bugging you, right?
Mm-hmm.
What's wrong?
The chair's scooching.
Stand on it for you. Having an adjustable height chair or stool is really handy for different sized people with these kind of techniques. I'm going to gently lay her head over, stabilizing and lifting straight up. Gently roll. Come back to that same position before we release that tension. Last one I've got up here that we're going to talk about here is just straight up squeezing, which for Tui Na they do not just with pressure between the fingers. In this area I'm not using a thumb at all. I'm squeezing between my fingertips and the palm of my hand. But once we have pressure on the muscle, we want to pull the muscle in the direction its fibers run. So I'm grasping her trapezius and I'm trying to separate my hands and head towards the acromion. You're not going to get that far, obviously, because you're hanging on, but you want to put a little bit of tension into the muscles in that direction. Squeezing can be very intense, so talk to your partner if it's too much. This is one, though, that you can get a ton of release in the upper traps in 15 seconds, 30 seconds of work. So don't be afraid to squeeze and hold that pressure. Good deal.